The Alberta Medical Association says upwards of 650,000 Albertans are without a family doctor. Now the province has agreed to a new payment deal for those doctors. It's betting that this will stop them from leaving the province.
I think the risk of losing family physicians to more attractive jurisdiction is done. This new model will make Alberta an enticing and competitive place for doctors to come and to settle and to set up shop and to stay for good.
And attractive for our learners to really think about doing comprehensive care.
What a pleasure to be able to sit down with Premier Smith today. An opportunity to touch base quickly before the health discussions we're going to have this afternoon. Obviously, it's a big priority for Canadians, and we're going to be focused on delivering results for them.
Canada's healthcare system is in shambles. Chronic inefficiencies, unbearable wait times, and a growing shortage of family doctors have left many Canadians struggling to access the care they need. Under Prime Minister Justin Trudeau's federal government, these issues have only worsened, with little meaningful action to address systemic problems. In contrast, Alberta Premier Danielle Smith has emerged as a bold and innovative leader, taking decisive action to tackle these challenges head-on. With policies designed to reduce wait times and improve rural access, Smith proves that targeted local solutions can succeed where federal efforts have failed.
Recruitment and retention of family physicians is a nationwide challenge. And here in Alberta, we think a big part of the solution is fair compensation and incentives that make sense. Our new model will reward physicians who build up stable practices and see more patients. With this announcement, I think the risk of losing family physicians to more attractive jurisdiction is done. This new model will make Alberta an enticing and competitive place for doctors to come and to settle and to set up shop and to stay for good. And that's exactly what we're aiming for.
As we move forward, I'd like to ask you a quick favor to subscribe and like this video. It takes just a second and helps so much. Smith's policies highlight the power of provincial autonomy in tailoring healthcare solutions to specific regional needs. Unlike the Trudeau government's one-size-fits-all approach, which often oversteps into provincial jurisdictions, Smith's decentralized model empowers Alberta to address its unique challenges effectively. Her resistance to federal dictates, like unbearable timelines for emissions, caps impacting health infrastructure, showcases her commitment to protecting provincial rights and resources. The Trudeau government's healthcare strategy revolves around centralized control, often emphasizing federal oversight at the expense of effective provincial collaboration. Despite intruding provincial jurisdiction, this approach has failed to deliver tangible improvements in critical areas such as primary care and rural healthcare access.
When primary care is strong, the rest of our health system is strong too. And I do want to sincerely thank Minister Adriana LaGrange and the Alberta Medical Association for their very hard work and dedication throughout this process. Today's announcement is a major milestone in our efforts to give Albertans the high-quality health care that they deserve, and it's a great way to cap off a year full of progress on primary care in this province.
These inefficiencies have left provinces like Alberta to carry the financial and logistical burdens of healthcare delivery without meaningful federal support, increasing differences in outcomes and access. Trudeau's healthcare policies often prioritize maintaining national unity and political image over addressing the pressing health issues that exist across Canada. Danielle Smith's healthcare reforms prioritize efficiency and sustainability, with a standout being the new patient panel incentive system. This model rewards physicians based on the number of patients they care for, encouraging them to expand access while maintaining quality of care. By aligning incentives with patient outcomes, Smith's system shifts focus from fee-for-service practices to more holistic care delivery, ensuring doctors balance their workloads across hospitals and community clinics. Recognizing the neglect of rural areas under federal policies, Smith has implemented targeted measures to address physician shortages and healthcare disparities in Alberta's remote communities. Policies such as financial bonuses, housing subsidies, and enhanced professional support make rural postings more attractive for medical professionals. Smith's government has eased the integration of internationally trained doctors into Alberta's workforce, accelerating licensing and reducing bureaucratic hurdles. Also, Smith's healthcare reforms emphasize proactive treatment and management of chronic conditions, reducing the strain on hospitals and lowering long-term costs. Because of this, patients with chronic diseases benefit from continuous, comprehensive support tailored to their needs. One practical example is the use of physiotherapy and other non-invasive treatments to manage conditions that might otherwise require costly surgeries. Danielle Smith's approach to governance is pragmatic, data-driven, and grounded in practicality. Her healthcare policies are continually updated based on feedback, like input from the Alberta Medical Association. She adopts a flexible approach, testing policies and adjusting them to meet real-time challenges. In comparison, Trudeau's leadership often leans heavily on words alone, with big declarations but minimal follow-through. This approach has been particularly seen in healthcare, where promises of national programs or federal funding increases have not been made into reality. Critics argue that Smith's innovative physician compensation model, which rewards doctors for expanding care, may not be sustainable in the long term. There are concerns about the financial practicality of these incentives and the potential for unforeseen consequences, like overburdened physicians or financial strain on the provincial budget. While Smith has made progress in addressing rural health inequities, critics may argue that these issues cannot be fully resolved overnight. Despite the incentives for rural service and streamlined processes for international medical graduates, there may still be gaps in access to care in the most remote parts of the province. Even if some of Smith's policies face challenges or take time to fully implement, they still represent incremental progress compared to the inaction or ineffective reforms often seen at the federal level. Smith's leadership proves that provincial governments do not have to wait for the federal government to act. Instead, they can take proactive steps to improve healthcare, tailoring solutions to their unique demographics and challenges. This empowers provinces to design and implement reforms that are not only more efficient but also more responsive to the communities they serve. It is time for Canadians to recognize that real, sustainable healthcare reform does not have to come from the federal government alone. Danielle Smith's success in Alberta is proof that provincial governments, when given the autonomy and resources to address local needs, can create healthcare systems that work for all Canadians. Canadians should advocate for healthcare solutions that are driven by local needs, informed by evidence, and shaped by the communities they affect. This means supporting initiatives that allow provinces to innovate and implement policies based on real-world data, not just federal mandates. As Canadians, we have the opportunity to push for healthcare reforms that prioritize the realities of our communities, solutions that are proactive, results-driven, and locally focused, just as Smith's leadership in Alberta has demonstrated. Now is the time to support solutions that work, ensuring that the future of Canadian healthcare is adaptable, sustainable, and centered on what's best for the people it serves. What do you think? Let us know your thoughts in the comments.